Hi, Jamie Davis at the ANIA conference in San Francisco. We're here talking about all things nursing informatics, and I'm here with Lynn Aguilera.
Yes.
And I got your name right, which is always a plus. This is our first interview of the day, folks, so bear with me. Lynn, before we get started in talking about informatics, just tell us a little bit about your background as a nurse, maybe why you wanted to become a nurse.
I wanted to become a nurse because I have a passion for teaching, and to me, nursing is all about teaching. I love my patients to know more. I love to teach people about nursing, and at one point in my career, I actually was a teacher in college as well as in the hospital. And my current position is a project manager for a transition planning company. And what we do is we go from hospital to hospital helping nurses prepare for operationalizing their space of a new building.
Excellent. So, the passion for education is important because we're going to talk about usability, and it's about teaching the nurses what's going on with the equipment and technology they have, but it's also about those nurses at the bedside teaching the other side about what they really need.
Yes, so I think usability is one of the most important issues right now that people aren't focusing enough on. I went to HIMSS last month, and I was a bit disappointed that they didn't have more sessions on usability. So to me, a lot of technology, especially in new facilities, sometimes there's anywhere from 5 to 40 new pieces of technology that the end user is supposed to just know how to use, and it's supposed to make our lives easier and the patient experience better, and sometimes it's just not as usable or intuitive as it needs to be.
So what's the solution? Is it that we need more nurses more involved with technology, or is it that we need to have the companies making that technology be more open to getting their information about what's really needed from the nurse?
I think it's a bit of both. I think there definitely needs to be research with the end users and the people using the technology and asking them more frequently, are you doing workarounds? Are you using or checking to see if the solution or the technology is being used the right way, and assessing their ability to use technology at the beginning, in the middle, and after implementation, and a long time after implementation, because a lot of times there's updates and you just get one little update, one little change, and it could just throw off your entire shift.
Absolutely, yeah. I've been in that situation. I've seen it happen with nurses that I know, and it's such a challenge.
Yes.
It's amazing. One little drop-down box moves, and suddenly you're like completely floored, right? Yeah. So we're here at the conference. You mentioned going to HIMSS as well. Why do you think it's so important for nurses to go to these types of specialty conferences to educate themselves?
Oh, I think it's super important to understand what's new, what type of technology is out there, that other people feel the same way as we do. At this ANIA conference, I've networked with a few people from different states, and we all have the same passions about nursing and integrating that bridge between technology and nursing. So I try to go to as many conferences, these technology conferences and informatics conferences, so I can meet other people who have the same issues, hoping to band together to make changes. So a lot of us, that's been the one word we keep saying is, how can we change this? What can we do? So that's a lot of the reason I come here.
Well, Lynn, thanks for coming on the show.
Sure.
And I want to thank all of you for checking out this segment here from the ANIA Conference 2016 in San Francisco, where we are talking everything nursing informatics. I'm Jamie Davis from The Nursing Show. Remember to check back both at ania.org and at NursingShow.com for more segments like this one.